Hello, it's Dr. Jones from The Healthy You. Today we're doing part two to understanding health insurance. And I have as my guest Mr. Jerry McMillan Sr., the owner and CEO of Macmillan Insurance Agency. Welcome.
Thank you. Thank you.
Tell us about insurance for those that are under 65.
Okay, for under 65, the thing that most of us are going to discuss is affordable care, also affectionately referred to as Obamacare because it came into effect under the Obama administration. And the salient facts about the affordable care is that it provides for subsidies for based on your income because health insurance can be prohibitively expensive. So the lower your income, the greater your subsidy. Now, a couple things that need to understand is that it starts at the federal poverty level, which for 2024 was $15,060 for a single person. It goes
Okay.
up to 400% of the federal poverty level. So a single person can actually be making as much as $60,000 and still have some level of subsidy to help pay for their health insurance. And it's scaled by income and size of household, so that the your combination of your income, household size, and age determine what your subsidy will be that is used to help pay for your health insurance premiums. And that subsidy comes in the form of a tax credit that is immediately available. And it's reconciled at the end of the year with your tax return, and you'll get a form called a 1095 form, which states how much you have received in subsidy, and it goes in your tax return. And in some cases where you don't use all your subsidy, you could get a credit back with your tax return. And one thing I'll caution people is it might be tempting to understate your income up front, but when you file your tax return, that gets reconciled. And so what you don't want to do is understate your income, have an artificially lower premium, and then when it's reconciled, it's like, oh, you made more than you said, and so therefore you owe the difference from what you received and what you should have received. So be accurate in stating your income so that you don't have issues down the road.
So, just to reiterate, what you're saying is that if you understate your income, it will catch up with you at the end when you file your taxes. And then they're going to ask you to pay back the difference that you should have been paying monthly in a lump
Correct.
sum. Okay.
Correct. All right. And so again, the lower your income, the greater your tax credit that is used to subsidize your premiums. And if that subsidy or tax credit is greater than the amount of the insurance, then your monthly premiums will be zero. And
Okay.
it just so happens that with the Inflation Reduction Act passed by the now previous Biden administration, it increased the amount of the subsidies. And last year in 23 and 24, 75 to 80% of the people were eligible for a premium of $10 or less, to put it into perspective, which is a tremendous difference than what it would be just walking in off the street to purchase health insurance. So it's a big deal.
That's a big deal. Yes. How do you maneuver uh, affordable care insurance?
Okay. I mean,
How,
you have some options. I mean,
how,
you could go to healthcare.gov and navigate the system on your own, or
mhm.
you can work with an insurance agent like myself, like our agency, to help you figure it out and maneuver within the system. And it does not cost you anything to work with an agent. we're not allowed to charge you money.
Okay.
That would land us in jail. So, so my advice is to work with an expert who knows what they're doing. Also, healthcare.gov can be a cumbersome system to maneuver.
Figure it out. Right.
So I advise getting some help. There are also people called navigators who usually work for a nonprofit who are available to help people to understand the language and the systems. But we actually access through a different system than healthcare.gov that's a lot more user friendly, that allows us to be able to get things done efficiently and effectively for people.
So I'm going to reiterate how important it is that you do have help. You don't have to do healthcare.gov. You can go and use an insurance agent like Mr. McMillan himself, and he will help you maneuver the system. The other thing is, um, just remember, do not understate your income, because
Correct.
it will catch up at the end, because when you
Correct.
file your taxes.
Correct. The analogy that I'll use is a lot of self-employed people have ways of reducing their taxable income. Okay. And that I think it's smart to reduce your taxable income in legal ways. Okay. Then, then they'll go to apply for a mortgage, and the mortgage company looks and says, "You don't make enough income." And they say, "What? No, 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 no. That's not my real income." Well, that's the income we have to use. So, similarly, but there are no penalties for not getting a mortgage. It would cost you to understate your income up front, because you're going to pay the difference that you should have paid when you do your tax return.
Either way, right?
Yes, yes.
Either way.
It will be reconciled.
Okay.
Now, there are private health insurance options outside of the subsidized world. Again, it is expensive, but it is available. It's always been available. It's just that most
Mhm.
people couldn't afford it. That's why the Affordable Care Act was created. Also, an important attribute of affordable care is there is no issue with pre-existing conditions. Okay. It's
Okay.
not individually underwritten. When you go outside of that framework, insurance policies are individually underwritten based on your health and the risk that the insurance company is taking on. So that was a tremendous difference when the Affordable Care Act was passed,
Okay.
because pre-existing conditions can cost your insurance to cost more, or cause you to not be able to get insurance at all.
If someone doesn't fall within the range to get the subsidy, affordable care, is it cheaper than regular outside?
When when you don't fall into that 100 to 400% of the federal poverty level, which again, for a family of four, it's about $125,000. Okay, and you make too much to get into that framework, you end up doing what's called off exchange,
Okay.
which is you're just paying essentially full price for the coverage without a subsidy,
Okay.
and essentially the same coverage, but you're just paying the full price.
Full price. Okay.
Yes,
Are there other options for insurance other than the affordable care and the private insurance?
there are different flavors of private insurance,
Okay.
and one of the distinctions is that there are uh, health insurance plans, and they look a lot like the insurance plans on the exchange. It's just that there's no subsidy. And the important thing is that there is an out of pocket maximum, which is the most you will pay in any year. So, what the out of pocket maximum says is, say, for instance, your out of pocket maximum is $7,000. So, once you have paid co-pays and co-insurance equaling $7,000, then your plan picks up all of the healthcare costs for the rest of that calendar year. Okay.
Okay.
And so then there are indemnity plans that don't have an out of pocket maximum, but they have a defined payment that the plan will pay for each type of service or procedure that's listed in your summary of benefits and explanation of coverage. So each type of plan is going to have documents that very specifically say what the plan will and will not do. Okay. And so you want to make sure that you are reviewing those details prior to signing up for a plan. You want to know, for instance, you want to know exactly what it's going to cost me to see my primary care. I want to know
Right.
exactly what it's going to cost me to see a specialist. I want to know exactly what it's going to cost me if I go to the emergency room. I want to know exactly what it's going to cost me for a hospital stay. I want to know exactly what it's going to cost me for outpatient procedures, be it a surgery or an MRI. Or so before signing up, you want to know exactly what those numbers are, know exactly what your experience will be with your healthcare plan.
I don't think most people pay attention to that when they choose these plans. I think a lot of people look at more so how much their monthly payments are. So what you're saying, it is a very important to pay attention to what you're expected to pay in
Correct.
choosing a plan. Okay.
Correct.
And whether or not
Uh,
you can keep your position, right?
correct. Correct. Most insurance plans come with a network, and you want to make sure that all your doctors are in network. And you also want to look at their prescription drug formulary, which
Mm-hmm.
is the document that states what medicines are covered and are not covered, and what level. The formularies will have medications in 5 tiers, going from generic to generic preferred to preferred up to experimental. And that's important because depending on what level it falls is going to determine exactly what your copayment is going to be for your prescriptions. So you want to look specifically at all of those items, because some people take 12 medications a day. Okay. And that can be very expensive, especially if there's no generic version available, or if it's a new experimental, it may not be covered under the formulary at all. So you want to see in writing exactly what that experience is going to be before you engage with a plan.
So is that something when they do contact you, they need to have a list of their medications, who their doctors are, so that when you help them to look for the affordable care plan, off exchange private plan, so that they will know which ones they need to pick. Because it should be specialized, just like picking a shirt or a car. You wanted this particular color or that color, or you want these things. It should be tailored to fit you. I found is that a lot of people just pick plans by the cost, and then they realize after they have the plan, because that's the other thing. If you could tell our audience how once you pick, you can't change until when?
Typically, there's an enrollment period,
Mhm.
usually in November, December timeframe.
Okay.
And typically, once that enrollment period is over, you're in the plan for the subsequent calendar year, and you have an opportunity to revisit it next year during the enrollment period. Now, there are some occurrences that open what we call a special enrollment period.
Okay.
Things like you get married or divorced, you have a child, or change in the family status, or you relocate. There's a list of occurrences that open up the opportunity to revisit your health plan. But typically, barring one of those changes, once you enroll in a plan, that's your plan for the year, except for non-payment. If you want to get out of a plan, stop paying.
Well,
Yeah, you will end, that plan will end abruptly.
very abruptly, right, right. Okay. So that's very important to realize it, because I know a lot of people get overwhelmed because there's just so many plans.
Yes,
And another point you made was be wary of people that charge you to help you pick your plans. That's a scam. They should not charge you. As you heard Mr.
correct,
McMillan say, they should not charge you. It is
correct,
free service. And it's also important, even though if you go to health.gov, unless you know these things, you probably need to reach out to an insurance agent because they can tell you what he just told you. Even as a physician, I didn't realize some of the things he just told me, but now it makes sense.
Unnecessarily complex, in my opinion. Could be
Hmm.
simplified, should be simplified, but we have what we have right now in the system
Right.
that we have. And so, yes, to answer your earlier question, you do not want to just pick a plan. Now, someone who's 26 years old, extremely healthy, may go get a checkup every 2 or 3 years or may not. It's different when you have health issues. It becomes paramount that you verify all of these costs and issues, especially when it comes to the coverage of the medications and what they're going to cost, coverage for procedures, and absolutely making sure that all of your providers, all of your doctors and specialists, and your hospitals and clinics that you engage with are covered by the plan. And I advise you to call those providers and make absolutely sure. One of the things that we've seen, and it's gotten a little better, but one of the things that we see is that you go and you look on the company's site or their list and they say, yep, that doctor is covered. Then in January, you go to get services and they say, we told them to take us off of that list. We keep getting people coming in here. That's an unpleasant situation. So
Yes.
you want to verify. In God we trust, all others verify. Okay. So if it says they're in the network, call the physician's office and make sure. Check with the hospital and make sure that they are indeed covered and will be covered for the subsequent year. They
Yeah.
do change and renegotiate. We had an issue here locally where a big insurance company and a big hospital were going back and well, several of them were going back and forth, and some people did not know if their insurance was going to cover that particular hospital, and it was a bit of a mess. But you want to make sure you want no surprises when you go to get service. That's not a time to get surprised.
That's why it's so important. Actually, it's actually more important that you do reach out to an agent, like yourself, agent with insurances, because they know these little nuances that most of us don't know. Let's talk about medications. The move now is a lot of people are trying to get on the weight loss medications. Do a lot of the affordable care cover the Ozempic, the semaglutide, the Manjaro, or you see that more with private insurances?
The Affordable Care is a private insurance company. Affordable Care is a payment mechanism to help you be able to pay your premiums. Okay, so a company like an Aetna, United Healthcare, uh, Humana, the household names, Ambetter, WellCare, all of those provide health insurance.
Okay.
Then what plan you're on is how you pay for your health insurance.
Okay.
Okay, and so, but back to the question about the coverage of some of the medications, they are all required to cover a certain amount of medications in a medication class. So, for instance, let's use insulin for, one may have Humalog, the other may have, another log.
Hmm.
And so you look at what insulins are covered by the plan that you're looking at and how they're treated. And that may cause you to get to another plan. If one plan covers that insulin, but another one doesn't, that's a real driver for the selection of insurance plans for people who have health issues and specific lists of medications that they have to cover. It's a deal breaker
Yeah.
because these medications without coverage are
Very,
extremely
very
expensive.
expensive. Right.
Okay. Most of us can't afford them. In fact, we have clients who get their medications from Canada. Okay. Because the same medication produced by a USA based company, you can get it everywhere in the world for less than you can get it here in the States. Strange, but true.
The other thing is to make sure if I'm going to need knee replacement, or I'm going to need my gallbladder taken out, or something like that. If you're choosing your plan, you need to see how much you're going to pay out of pocket for the plan you choose, or even if they cover that. Correct?
Exactly. Every plan, whether it's affordable care, whether it's Medicare, Advantage, or a straight off the market plan, is going to have a maximum out of pocket and a deductible. Some of them will have a zero deductible. Some of them will have a crazy expensive deductible. Okay, so you want to know, and what's a deductible? It's what you pay out of pocket before the plan starts paying. Okay, so zero deductible is a really good number. The maximum out of pocket is what's the most that you will pay out of your pocket for co-pays and co-insurance in a plan year. Okay, so those
Does
are
that
really
include
important.
medication?
That it depends. If it's a prescription drug plan, yes. If the prescriptions are included in the health plan, then yes. Some of them will have a prescription deductible and a medical deductible. Some of them will have a deductible that's just deductible for all of the above.
All of the
And they will
above.
have a maximum out of pocket, which is the maximum you will pay. Or in the case of a Medicare, where you've got a prescription drug plan, the
Mhm.
prescription drug plan, as of 2025, the maximum that a patient can pay for a Medicare prescription drug plan is $2,000.
Oh,
Some other innovations is that insulins have been capped at $35 per month per insulin,
oh,
which is a
good.
tremendous savings. I saw something that says on average that alone, those things alone will save an average of over $2,000 per person. And
Yeah,
so that's a big deal. For people for diabetics who are insulin dependent, that's a big deal, a
big
tremendous
deal.
savings. And we're talking about life or death savings, because if you can don't get your insulin, then that's a life or death issue.
Right. Then you end up in the hospital. Then you have more bills, and
And,
the
and,
story
and other
goes,
complications.
and other complications, and the story
Yes,
goes on. Correct.
yes, yes. And so those medications are a key driver in what you choose in terms of a plan. Sometimes as the monthly premium pales in comparison to what your expenses will be based on what your health situation is. So you need to look at the whole picture. And we put together a document, cautions before choosing a health plan, that you can access on our website, that gives you guidance and being able to look at, and it'll show you how to compare plans side by side and take a look at them. So those are tools and resources available at no cost at
Oh,
alltherightplans.com.
let's talk about FSA card and HSA cards.
Savings accounts. There
Mm-hmm.
are specific types of plans that allow you to use a health savings account. What that is that you can use pre-tax dollars. You can put pre-tax dollars into an account that then get used to pay for some of your co-pays and co-insurance. Not all plans allow
Okay.
a health savings account. And once you go on to Medicare, you won't be able to get a health savings account. But if you have money in a health savings account, you can still use it until those funds are exhausted.
Can you use it to pay for your Medicare cost?
To you can pay for your costs of of your
Whatever.
Medicare, your premiums, or your co-pays, or your medications. But that health savings account is preset pre-tax dollars to pay for that you set aside to pay for your healthcare expenses.
And you own it, and it doesn't go away.
It doesn't go away.
Right.
Okay, and it's usually works with a high deductible plan. Not all plans allow for an HSA or FSA, so look at the particular plan and see if that is an option or not an option.
So pretty much people can use it as a tool to save pre-tax if they know that they are going to have to come out of pocket with like 20% where that the insurance doesn't cover.
Exactly, it's a way of uh, going from paying taxes on money for instance, just to simplify it, if I've got $100 expenditure and I've got a 20% tax rate, okay. If I make $100 and pay my taxes, I've got $80 left to pay expenses with. If I use the pre-tax money, I've got the whole $100 and I've reduced my taxable income by that $100. Generally, if there's an opportunity to use pre-tax dollars, it's to your advantage to use pre-tax dollars versus post-tax dollars.
The FSA card, you actually lose your money at the end of the year, correct?
That does not roll over from year to year. Correct.
Okay.
HSA does, FSA does not roll from year to year. So
Okay.
it's important to distinguish which you have, which your plan makes available, and govern your planning accordingly. So for an FSA, you don't want to put more in there than you're going to use for this year. For the HSA, it can be used as a more of a longer term outlook vehicle.
Thank you very much for giving us all this valuable information and helping people navigate our health insurances in the United States. So what are 3 tips you would leave everyone?
The first tip is get some help from a competent advisor. The second tip is to examine the details on your coverage before you sign up. There are documents called the Summary of Benefits and Evidence of Coverage and a prescription formulary that you want to have to review and make sure what your experience is going to be. And third, make sure you're working with someone who's not just signing you up, but will be there with you this year, next year, and in the middle of the year when the insurance company does something stupid and you need help to to go to bat.
To figure
Those
it
are my
out.
3 tips. Those are my 3 tips for the day.
And can you tell our audience again where to find you, all your websites and
Okay.
everything?
Alltherightplans.com, because we got all the right plans at alltherightplans.com. And our 800 number is 800-420-4577. 800-420-4577. We're in 14 states, and if we're not in your state, we can add your state if we need to.
Awesome, awesome. Well, thank you for coming and sharing that information with us. And to all our viewers, understand you need help choosing your healthcare plans. So reach out, be intentional about your health plans, about what you do with your life, because your health is greater than your wealth.